Welcome, everyone. Good morning. See some of you coming in. Thank you for joining us this morning. My name is Shaddai Martinez Cuestas. I will be one of your presenters today, and this is a webinar of framing and communication to make the case for public health. And this is presented by Act for Public Health. And I'll have Sarah Bartel tell us a little bit more about the initiative with the Public Health Law Partnership.
Thanks so much, Shaddai, and welcome everyone. We're so excited that you're here and that there is so much interest around this really important work. I'm from Change Lab Solutions. I'm a senior attorney, and we are part of the Public Health Law Partnership. And Act for Public Health is an initiative of that group in partnership with a number of other national organizations. And we're working with state and local health departments on the ground. So I've dropped the link into the chat. You can read more about our work, the work of our partners, the research, the TA, and other opportunities for partnership there. And thank you to BMSG and Real Language for all of your work. This is building on research and trainings that you all have done and I've been a part of, and I'm so excited for this next iteration. Thank you so much and welcome everyone.
Thank you, Sarah, and thank you everyone else for joining. I know there's more people joining us today, but there's a lot that we want to cover. We also want to have some time at the end for questions. So we are going to just jump right in. So again, my name is Shaddai Martinez Cuestas. I'm head of training here at Berkeley Media Studies Group, and I've been here for about 4 years. And I'm joined today by my colleague Chinyere Amobi and my colleague Catherine Schaff, who will be on a chat available to answer some comments and adding resources also with Saniha. And we also have Alyssa and Eric from Real Language. Welcome. So as folks continue to trickle in, we just want to go over quick logistics. You should be familiar with all of these by now, but just so that we all are on the same page, we did enable captioning. So make sure you go into your the 3 little dots and enable captioning so you can see that on your screen. This session will be recorded, so we will share that after the webinar. Please use the Q&A for questions. We will get through those at the end of the webinar. And join us in the chat for discussion, comments, reactions, whatever is coming up for you as we are covering the material. We are not going to make this super interactive, but we do want to make sure that you're getting some comments and reactions to what you're saying, what we're saying. And lastly, we will share the materials afterwards. So don't you worry, you'll get the copies of everything that we will cover today. So let's just get started. So what we are hoping to achieve in today's presentation is that you are able to align your communication efforts with your strategy so that your messages and the way that you're communicating about public health supports your goal, supports what you're trying to achieve. We also want to share some language and framing research that can enhance your messages about public health and its authority, its power to keep all of us safe. So with that, we'll do that in 5 tips. We condense a lot of material that we've sifted through, and we will give you 5 tips around that, and then we'll have time for Q&A at the end. And before I do that, I will also say who Berkeley Media Studies Group is. Just too excited to jump right in. So Berkeley Media Studies Group, we are a public health organization. We're part of the Public Health Institute here in California. We've been around for about 30 years now. And what we do is we support and help advocates, public health advocates and social justice advocates leverage the news to advance public health policy. And we do that through research on how the news covers health issues, how it frames public health issues, and how it supports, it doesn't support advocacy efforts. We also do training and capacity building. We focus a lot on framing and strategic communication, but also how to work with the media. And lastly, we also partner with journalists to create resources so that journalists can also have some tools to incorporate a public health perspective in their reporting. And for this project with Act for Public Health, we partnered with Real Language. Real Language is a language and linguistic strategy firm. And what we did is take a deep dive on language and framing to see what can we do better when we are how can we do better when we are communicating about public health, and it's keeping its authority to act and to keep all of us safe. So with that, we'll get started with tips. So the first tip that we want to talk about for our presentation today is to let your strategy dictate your message. So what do you want people to do as a result of your messages? And what are you trying to achieve? Public health professionals really need to be able to respond quickly and effectively to advocate against all of the attacks that the field is getting right now, legal attacks. And we will do that as part of a strategy. So we need to be ready and prepared to do that, but not in a vacuum. We will have a strategy, or we will have a plan and work in collaboration with other people. We also want to say that messages alone will not solve it all. It won't convince everyone, but messaging and communication is really important. And the goal here is that it supports your strategy and supports the goals and what you're trying to achieve. So we always say message is never first. First is strategy. Knowing your strategy will help you make strategic communication decisions. We know we have to act quickly. We have to, we don't have a lot of time. So we want to be as strategic as possible. At BMSG, we have a resource called the Layers of Strategy, which is a guiding structure to organize our communications and advocacy actions so that they are in alignment and that they help you be as strategic as possible. And the first layer is the overall strategy. The second layer is media strategy, then message strategy, and then media access strategy. We will not get into all of those today, but we want to go through overall strategy real quick because that's key for how you're going to craft and put together your messages. So this is a simplified or modified version of the overall strategy, but it's essentially answering these questions. So what is the specific bill that you're advocating against? So what are the details of it, and what is it doing to public health that you want to talk about? Who has the power to reject it? So it may be state legislators, it may be county boards of health or other groups. So really knowing who is the person or the body or the group of entity that has the power to reject this bill, because this is your advocacy target and it's also your communication and messaging target. But you may have some secondary audiences, and that could be, board of supervisors, city councils, or judges, or other people. It can also be people who can influence your target, your supporters, your base, your allies. And when you are thinking about these secondary audiences, you also want to think about what you want them to do. So how are they going to influence your target? So whether it's to call representatives to submit public comment, to show up at a meeting, whatever it is, having that action very clear. And then along with actions is knowing what else are you doing aside from communicating about it, and how communication can support those actions as well. I do want to acknowledge that some of you, because of your funding or because of your roles, may not be able to lobby explicitly against a specific bill, but a lot of the recommendations and the tips that we're going to give you are about talking about what public health is and what public health does, and that's going to set the frame and highlight why public health is important and worth defending, so others may be able to say more explicitly, reject this bill, and while you can just say, this is what public health matters, and this is why public health is important. Now, I want to talk about message strategy. So again, the tips that we're going to get into right now are pretty much going to be focused on framing and message, but we do want to acknowledge the other components of a message strategy, and that is the messenger. And so that's you, and thinking about what your role is as a messenger, what expertise or lived experience that you're bringing into the conversation. And again, how much you can say and how much you can't say, and who else are you partnering who can voice those other more upfront advocacy messages. Now, thinking about your target, again, going back to that overall strategy, who is that one person that you want that has a power to vote or strike down or to pass or reject a bill? That's your target, and your secondary targets. What I do want to say here is that the public at large is not a strategic target. Having the general public tuning in and understanding what is at stake is important, especially when we're talking to the media, through the media, because that's going to add the pressure to those decision makers, knowing that the general public is listening and paying attention. But we just want to make sure that we are under no illusions that we're going to convince everyone with one single message, that we want to be strategic and target those decision makers, those who can influence decision makers, and then our allies, our base, our supporters who we want to mobilize and activate so that they can also add more pressure. And lastly is the setting where it's going to be said. So some of you might be able to say and advocate in direct conversation with legislators, and that's great. And some of you might be providing testimony or comments at hearings, maybe as an expert witness. You may be doing media interviews or submitting your own opinion essays or letters to the editor. So all of these different settings will have a little bit of an audience beyond your target. And so that's why we want to make sure that we keep that in mind, but we know that that's not our strategic target. Moving on, we want to talk about framing a little bit, and this is tip number 2. We want to frame public health as something that is indispensable. And we're going to do that through shared values. We can do that using metaphors and analogies. But essentially what we want is to frame public health as something that is key to our society's functioning and that we cannot do without. So why framing? Framing is important because the way that we talk about an issue is going to affect how people and audiences understand the problem, who's responsible for it, and what needs to be done about it. And so in the next slide, and this is the one time where we're going to have you all share a little bit in the chat, is where you want to see if you can read the words behind this box. So if you can, in the chat, real quick, enter what you see behind this box. All right, Cassandra was the first person. Fabulous. Thank you. Prevention works. Excellent. All right, so that's great. That means our brains, we're all awake. So the reason we can see prevention works, and we use this exercises to show how framing works essentially in our brains. And cognitive framing refers to these connections that we make in a split of a second in our brains, and we make associations based on what we're observing, based on the information that we're receiving. We immediately make those connections. So just like you did here in the chat, you immediately made that connection. And that is because we have familiarity with the language. We know prevention works. We are in public health. So all of these things are familiar. And the more we hear something, the more the easier it is to queue up those concepts. And so the same happens when we are talking about public health and what public health does. And it's very relevant because those clues are going to be the words that we use, the images that we evoke in our language. And we want to make sure that we use the words and the images that are going to send people to understand public health as indispensable and not send them astray like we did here. So when maybe you don't have all the information, you just had a few clues, but your brain did the work, right? So what we want to do in our messaging and in our communication is to be as clear as possible and send people in the right direction. So we do this exercise to show that there's no blank slate. People make connections based on what we hear, what we live through, what our knowledge is, our set of values and beliefs about how the world operates. And these frames get reinforced every time we hear them, and they work by repetition. So the more we hear them, the stronger those pathways in our brains get. And so we like to think about the train of thought. So, just once you're on it, and it's really hard to get off of that track. And so that's what we want to do with framing. And in our culture and based on our studies of the news, there is a very strong frame, which is what we call the portrait frame, and I'll explain what that is, which is we see in the news, but it's also reinforced by the popular culture, like the movies, the music, the stories, everything that surrounds us is reinforcing this portrait frame. And this portrait frame is really evoking this narrative of personal responsibility, that you're on your own, that you do this to your family. We have a market that's going to solve it all, and therefore we don't need government. And so we as advocates, we need to confront this narrative, this dominant frame, especially around the government that that has been pushed for decades by a strong anti-tax movement. And this is important for today's conversation because public health as a branch of government is also under attack, and it's part of this movement as well. In contrast, and what we offer is the landscape frame. And the landscape frame is, if you're thinking about portrait of just showing the individual and the person and the details, the landscape is going to show us expand and show what's surrounding someone and how those surroundings, those systems, those structures, the things in our environments are shaping our behavior and our health. And so when we do that, we can evoke that shared responsibility that we do really, truly are in this together. And that's why we have a duty to the collective good. That's why we're aiming for social justice, and that we want to emphasize and evoke and elevate our role for government to protect us, that there is a role for government, and then truly government is what is how we get to do the things that we need for us that we can't do alone. So we know that these two are in competition, but all of us can hold both of these together in our heads. And what we want to do in our messages is cue up the landscape so that people are thinking about shared responsibility, duty to the collective good, because that's what public health is doing, and that's what we want to elevate. Now, how do we frame public health as indispensable? Consider how how fire departments are framed, and think about framing public health in the same way. We want to make it indispensable, key to our functioning. We don't want to do without a fire department. So this can, there's a lot of parallels that we can use with firefighting, fire departments, and public health. Firefighters do prevention and do a lot of ask us to do a lot of things for prevention, like tree trimming, ventilation standard, fire exits, all of these things. So they have that power for prevention in the same way that we have a power for prevention in public health. They also have the power for intervention. I could not put a fire out by myself at in my own house, but that's why we rely on a government entity to do that, and that's how we are pooling our resources together to do for each other, to do for one another, and that's what we want to evoke when we're talking about public health, that we are doing something for each other that we can't alone do. And firefighting, also works with some of these legal attacks, that it makes no sense to move firefighting to our legislature, right? Our elected officials can make some decisions about budgets and other things, but in the middle of a fire, they need to get out of the way and let the firefighters do their job. So we want to evoke the same feeling and the same idea when we are talking about public health. Here is an example from Trust for America's Health, and this is an argument in a report to invest in public health infrastructure. And what I have here in bold is how they're using the firefighting metaphor. So not investing in public health infrastructure is akin to hiring firefighters and purchasing hoses and protective equipment amid a fire alarm. So it doesn't make sense, right? We need to do this in advance. And that's just one way to use firefighting as a metaphor. At BMSG, we do collect every year media bites, which is short, concise phrases that we see in the news that are very effective. And last year, we found a lot of metaphors using firefighting and fire departments and fire metaphors. So feel free to take a look at those when you get a chance. We'll put those in the chat as well. Another way to continue to frame public health as indispensable is to highlight public health strengths. We want to lead with what we do, what we're doing, or we can do for each other and for the greater good. We want to avoid emphasizing pre-existing weaknesses or the disinvestment in public health, or at least not lead with that. That if we do that, that is triggering a reasoning that if it's already weak, just let it die. Or if it's so neglected, it must not be so valuable. Or if it's crumbling, it's unworthy of resources. So we don't want to do that. We don't want to trigger that idea, just like we did with the orange box. We don't want our audiences to go there immediately. We want to lead with what public health is and does. So here's a couple of examples that we've seen, and we've seen this a lot. And I think the reason we've seen this a lot is because it's true, right? We are facing all of these things. And what we are saying is that we just don't want to lead with this. We don't want to overemphasize or focus too much on this. So what can we do? We continue to highlight public health strengths and showcase what we do, what we can do for the greater good. Here's an example from Dr. Benjamin that was published earlier this year. And this letter did start with some of those deficits. And so what we would do is just flip them, right? And start with the highlights and the strengths that and the things that public health has done. So here in bold, I have public health researchers have found vaccines against SARS-CoV-2 to be safe and effective. 210 million people have been fully vaccinated. Millions of lives have been saved. So really uplifting the work that we've done during this pandemic, in spite of it all, right? And then you can talk about the challenges. And once you establish the role of public health and what's done and what's worth saving, then you may say, and that's why we need to continue to invest. And that's why we need to continue to put resources into this very important and indispensable public good. So I'll pass it on now to Chinita to talk about the next couple of tips.
So as much as possible, and hi everyone, Chinyeta here. As much as possible, we want to highlight the strengths of public health and public health workers as competent, confident, and active. So in the next couple of slides within this tip, we're going to talk about how to use action words, active language and images to actively highlight public health's role in contributing to essential public good. So really thinking about how do you paint that picture of what public health does towards the public good in society. Public health needs to be seen as deserving of the authority that it has. It currently faces a lot of criticism of having more authority than it actually should. And while there's no magic words that'll work in all contexts, as much as possible, you want to evoke that confidence in the necessity of public health authority. So this list serves as kind of like a self-check of like, there may be times when you can use the words in the first list because you're limited in the sort of directives and mandates that you're able to give. But as much as possible, really thinking about whether there's a better way to use clear, concise, direct language to talk about public health authority. So we're not saying like absolutely don't use guidance, don't use evolution, don't use might, but sometimes these words can come off as vague and they may not communicate the kind of urgency that people want to hear to have confidence in public health, especially in a crisis such as like the COVID-19 pandemic. So as much as possible, thinking of when can you use those clear, concise, direct words, direct language, and in this case, such as requirements, directives, orders, to really evoke confidence in public health authority and the necessity for it. So as much as possible, you want to really portray public health workers as competent, confident, and active. And one way to do that is to really describe public health people in action. So using these kind of active words to paint a picture of what public health is actually doing towards the public good. For instance, public health workers deliver vaccines, deliver medicine. We prevent the spread of diseases. We decide, we track, we prevent, we deliver. You want to use those direct verbs that connect the public health worker to the direct action, the direct service that they're giving to society. As much as possible, you want to avoid hedging, using those words that kind of get in the way of connecting public health with its active role in society. In this example, we have, instead of our decision making, we decide. Instead of we seek to protect, we protect. Instead of it seems like, we know that. And another way to use active language is to avoid passive voice, because passive voice is another thing like hedges that really separate public health and public health workers from the very active role they play. So really avoiding that passive voice and thinking of how can I paint that picture of public health's active role in society. And this image is from a recent training that we did. We did a brainstorm with another group to just asking them, what does public health do? Like when you picture public health, when you picture the work that you do, what are the active words that come to mind? So people thought of words such as help, track, protect, inform, enforce, solve, prevent. These are just, you could have these in the back of the mind as you're doing your messaging, as you're preparing to speak to the media, as you're advocating against these bills, thinking of what are the words that describe what my health department does or what my organization does. How can I paint that picture of the active role that we play in society? And this is an activity that you can do with your own team, like really sitting down and thinking, putting that in your local context and aligning it with your own organization's values. But what are those what is that active language that you really want your target to understand about your essential function towards the public good? And so this is a sample message talking about the pandemic response, public health's pandemic response. And there's not anything necessarily wrong with it when you initially read it. Early in the pandemic, our public health workforce took quick, decisive action to protect our essential healthcare workers, who in turn protect all of us by triaging masks to our hospitals. They also worked night and day to analyze the situation and make decisions based on new data and new supply chain developments, such as more cloth masks being available. So while it does say what public health did in this situation, the language isn't particularly strong in painting that picture of the actual action that public health took. So as you'll see in this other version of this message, we infuse active language into the message to really paint a picture of what did public health actually do. So the health workforce jumped in right away to protect our essential healthcare workers. They got desperately needed masks to the hospitals. They stayed on the trail of the virus. They strengthened guidelines. They urged mask use. So with this direct language, you really have that picture of what public health does. You don't have to do the work of imagining why was public health needed in this situation? What did they actually do? You have these verbs that help them paint a picture. Because as we know, when public health is working, you often don't see any of the activity, and that's a good thing. But with medicine and other things, you see that direct action. And as much as possible, we want to infuse that into how we talk about public health authority when we're defending it in the face of all of these attacks and these bills.
And I just want to jump in real quick here to say that this tip about portraying public health as competent, confident, and active is, we're giving you some recommendations and some guidance, and just thinking about how the language and those words will cue up ideas and concepts in people's heads. You will know your local context a lot better than we do, and so just take these recommendations, for something to consider as you are reviewing your talking points or as you're reviewing your materials. What is this word evoking, so that the words you might choose some different ones. And then, but the main point, I think what I wanted to say here is that our opposition is using very confident language, even though they don't have all the facts and they're not, they're not accurate and they're not being precise when what they're saying. So and that confidence that they're evoking is what is, it's getting a lot of people to follow or support. So whenever we can, we want to portray that same level of competence and confidence, because we do know we have the data and we have the information that we want to share and to back up what we're saying.
Thank you. And so tip number 4 is to use plain and descriptive language when you're talking about the need for public health authority and defending against these bills. So even if your target is a judge or legislators, when you use simple language, you make your message more understandable, more visceral, and you help people paint a picture of what you're saying in their minds. Additionally, if your message ends up in the news or in a public hearing, you also have that secondary target of the public. And the simpler your message is, the better you will reach those secondary audiences that might not have a public health background or a legal background. So jargon and technical language essentially refers to that kind of insider language or phrases that might be tossed around a lot in public health circles, in health departments, or even in advocacy circles. And we understand what they mean, but the average person, legislator, example of kind of legalese language that highlights the need to like really simplify and take out those technical terms. You can, so this message says, and this is taken from a CNN article, if the 11th U.S. Circuit Court of Appeals, which oversees appellate challenges from Florida, where the federal judge who struck down the mandate sits, upholds the ruling striking down the mandate, it would be precedent for all other federal courts in that circuit, which covers the Southeast. So some of you might have immediately understood what that meant, some of you in the audience, but I can almost guarantee that the average person, this is almost like a tongue twister for them. So really thinking about like some of the phrases in here, appellate challenges, struck down the mandate, precedent for all other federal courts. These are kind of terms and phrases that make people pause and have to think about, what are you talking about? Might even make them have to reread your message. So as much as possible, really thinking about how can you either pluck those out or describe them using plain language. So this is kind of we've plucked some of these pieces of jargon and technical language from other work that we've done with health departments and other public health organizations. But you see, these are kind of terms and phrases that some of them aren't necessarily technical terms, but they're phrases that we use often without explaining, such as health equity even, or equitable health outcomes. We understand what they mean, but really using plain language to paint that picture of what does that mean for the average person? What does that mean for your target or any secondary audiences that might hear your message? So this is an example of two of those from that word cloud. One, preemption. So the way a community using plain language is stops local community getting what's best for themselves. So we know that there's times when you will have to use words like preemption. And so we're not saying that they must be eliminated absolutely, but really thinking about ways that you can use plain language to further explain what you're saying with these terms. Another is shift in authority. And this means the state legislator, a group without public health training and expertise, takes away the power to make decisions about community health from local public health leaders who have the training and expertise. So not only does this break down but it also picture health expertise, taking local power away from public health leaders who do have that training and expertise. And we know that it's like power and authority are very sensitive right now, especially with the popular frame of the government as having too much authority, or public health as having too much power, and these two entities kind of working to take people's rights away. We know that's a popular frame right now. So as much as possible, you don't want to use power and authority alone. You want to really describe or expand on how that power and authority is essential to public health's function towards the public good. So really thinking about how can you connect that power to the public good. For instance, public health has the power to keep our loved ones healthy and safe, or we must protect the public health authority to make decisions that help keep us safer and healthier. So really thinking about, as much as possible, both with plain language and with active language, how do you connect public health with its very active role in pursuing the public's good?
So yeah, expanding what power to do what, or the authority to do what, and to have that what be something we all want and something that we all want to support. Our next tip is about, and this is the final tip, is to describe how bills and lawsuits are blocking public health and public health action. And so the previous tips are talking about strategy and also how to frame public health, which I just took a glance in the chat, and I know that we've struggled with what public health, saying succinctly and shortly what public health is. And so that's one of the most important things to do, because we want to evoke in people's heads why it's so important and why we need to keep it and why we need to keep it as authority to keep us all safe. Then we are now facing all of these bills, all of these lawsuits, all of these attacks. And so how do we respond to those? In your own local context, it will vary and it will depend on your strategy as well. But in the details of the bills will be many, because of there's many around the country. But in general, what we want to do when we are responding to these attacks and we are defending the role of public health, in general, we want to describe how these are blocking the role and the work that public health is doing. So we want to really highlight that blockage piece. And so using words like tying our hands, it doesn't let us do this. It stops us from taking over, take away, limit, get in the way. All of those words or phrases that highlight that blockage is what we want to do, because, and then obviously follow up with what all the great thing and amazing things we do in public health, so that to highlight that, that the bills are going to stop us from getting what we want to get. Another way to do that is to point out the irony of how we are being demanded results while also being taken away the resources and the tools that we need to create those results, including the authority to do what we're doing and the resources to do what we're doing. So pointing out that irony, you're telling me to, stop the spread, but also not letting me do all these things and not letting me put these mask mandates on place and all of these things that we know work. Another way to do that is to appeal to common sense values, how we are not taking advantage of resources and efforts and expertise, or how these bills will prevent us from taking advantage. We have a lot of expertise. We have a lot of dedicated workers, epidemiologists, nurses, social workers, people who are doing this work. And if we are blocking their role and their work, we're going to essentially throw away these valuable resources. One last thing to mention here, and this is whenever possible, again, it depends on your local context, is to name the specific decision makers behind these bills and these lawsuits. So that goes along with another recommendation that we often give in our trainings, which is to avoid the passive voice. When we are saying these bills will do that, we're not naming who is behind these bills, who are the people behind them. So these are decisions that a person is making. So as much as we can, again, depending on your context, name the legislator or the person behind this and how they are blocking, demanding, wasting public health resources or expertise. So that it's not something that just happens to be, or just a bill that just popped up out of nowhere, that it is something that somebody is behind, and we can stop them and they can make a different choice. Here's an example that we wanted to just give you an example of one instance and how to respond to that. So just so that you have something to look at when you are preparing your own responses. So this is from Philadelphia a couple months ago. This is a lawsuit that was arguing that Philadelphia doesn't have the authority to enforce the indoor mask mandate, and that it goes against what the CDC was recommending at the time. So here's our sample response message. Our duty in public health is to keep Philadelphians healthy and thriving. This means we must respond quickly to new developments, such an increase of new cases in our city, with strategies at work, such as mask orders. We do this all the time, but especially in times of crisis. this lawsuit will tie our hands and leave us unable to respond, adapt, and inform the public on how to stay healthy in real time. That's why we asked the judge to dismiss the case so we can focus on what matters the most, the well-being of Philadelphians. So you can see here, we put in orange, this lawsuit will tie our hands and leave us unable to, do these things and respond, adapt, inform, all of those active action verbs that we talked about earlier. We also wanted to highlight here that we will also have a tool to develop strategic messages, and that always includes naming your problem, naming your solution, and naming your values. And we're not going to get into that, but we also have a resource that we'll put in the chat and we'll share afterwards too, to develop strategic messages. But we want to highlight here where these components are. So we start with values and end with values. Our duty in public health is really evoking that sense of duty to the collective good to keep Philadelphians healthy and thriving, and using pride of place, pride of who we are or where we are. Same at the end, focus on what matters the most, the well-being of Philadelphians, putting that human element and that's at the core of why we're doing this. The problem is narrowly focused on how the lawsuit will tie our hands or block the work that we're trying to do. It's not going into all of the details of the lawsuit. You could go there depending on how much time you have, but in essence, a core message will have that, it's the big problem that we're facing right now is it will tie our hands to do what we need to do to keep everyone healthy. And then the solution is going back and really emphasizing what public health does and how we respond. We respond quickly, we do this all the time, we adapt, we inform, and why we're asking the judge to dismiss the case. So really including the action. So if you're gonna have calls for action on social media to your allies, make sure you include that, right? And I think we see that a lot on calls for action. Call your senator or call your representative or submit your comment or all of these things. So having that clear action as much as we can, again. So, again, like we've said, and we just want to make sure we have this as a caveat for the presentations, that we know there's a lot of bills. We know they are across the country and you have a very different context. So these are recommendations that may or may not apply all the time, but we're giving you a menu, and so that you can see what fits best, what feels good, what do you feel that you can do in a short amount of time. And you can always come back and reiterate and review and keep adding and tweaking your language as you have more time to do that. But lastly, we want to give some framing considerations. George Lakoff always says the first frame has the advantage. And so whenever we can, set the frame of the conversation and set that path where we want to send our audience to, we should do that. However, because we're getting these attacks from left and right, it's hard. We are in reactive mode and we can't necessarily frame first. So what we need to know is to reframe the conversation, always go back to what public health is. Why is it worth defending? And lead with that, go back to that, and use this description of how the bills are blocking what the role of public health can be a good pivot to go back to what public health is and why it's worth defending. And we just wanted to close with a sample message from Sarah Degia from Change Lab Solutions. This is a message that was developed during training that is using a lot of the plain language, the active verbs, and describing what public health is. So just as an example for you to see how you can start putting together your messages that are more descriptive and paint a vivid picture in people's heads. So what she wrote is public health workers are dedicated public servants working for the greater good to protect us from illness and disease and unhealthy conditions. They educate us about healthy practices, monitor patterns of disease and illness, connect us to programs and services, and they share practices and policies that keep us all safe. So really evoking values of interconnectedness, values of our duty to one another, and describing what public health is. Again, this is not perfect. You can always continue to enhance your messages and describe as much as you can in as much space or time you have allowed in your messaging. But we wanted to have some examples from the real world that can be used as inspiration. So we'll wrap up with a summary, and then we'll have time for Q&A.
So just to summarize, since we remember by repetition, let strategy dictate your message. So think about the specific bill that you're trying to get lawmakers to reject, who has the power to reject it, who else you want to reach, those secondary audiences, and what actions you're going to take. So really thinking about that strategy before you even get to the message development stage. Also framing public health as indispensable, thinking of what kind of metaphors you could use, such as comparing it to something that people easily understand as essential, something that they can't do on their own, such as firefighting departments. But confident and thinking of language, vivid picture role in the public good. Also using plain language and describing technical or vague language or jargon. So I think about how you can either pluck those pieces of jargon out of your messaging.
Oh, Chineta, you're cutting off. I'm gonna just wrap it up here. So yeah, just using plain language and sometimes having somebody else take a look, somebody else who doesn't work in public health, but doesn't work in law, to point out those pieces of language in your talking points or in your drafts. And lastly, describing how bills and lawsuits are blocking public health. So really emphasizing those pieces of whether it's blocking and stopping public health from doing what it needs to do, demanding without giving us the resources, or really not taking advantage of our expertise and our research and our efforts and our willingness to do the work. So we're gonna have, here's our information. Again, we will share all of this material with you all after the webinar, but we wanna move on to Q&A so that we can answer some of your questions. And even though we won't have a lot of interaction, at least we can take some of those questions and answer those. So I'll stop sharing here and start looking at some of the questions. So we have a question here. How do we message so we don't divide our audience, and does landscape framing do this? And it seems like there's a couple of people who are using this question. I believe the landscape framing, but I'm afraid, especially in this political climate, that it will be rejected outright by a significant segment of the population. Are there ways that message can frame so that it doesn't immediately divide our audience? So that's a really good question, and we get that a lot, especially for folks who are working in very conservative areas. What we want to do is cue up that landscape in our audience's heads. And so we are capable of holding both. And so the more we use the landscape, the more we emphasize that language, the more it'll be reinforced in our audience's heads. And so it may not always convince everyone, and that's okay. If it sounds canned or like boilerplate, it says here, then you can infuse it with your own language, and that's what we always want people to speak from an authentic place and from using your own voice. So whenever you can use your own voice to evoke that, and this takes practice, but I think it's still really powerful and really useful to do that. And I don't know if Alyssa or anyone else has an answer here.
Sorry, my unmute failed there. No, I think that was excellent, Shadai. I think I absolutely agree.
All right. Any other questions? I see a question here, questions about triggering people with mandates or government overreach. How do we avoid triggering people with the idea of mandates, says Brian, or if some of those clear words evoke negative reaction like government overreach. Any thoughts, Eric or Alyssa?
No, I would respond to that twofold. One, echoing something Lori alluded to in the chat, is that that's going to happen sometimes. There are going to be people that are going to be triggered, as you say, by that, and they may be people we can't reach anyway. But number two, if you think that that is happening in an audience that you can reach, there are additional words that you're able to use. There are things like direction, right, or advice. There could be even, there could be other ones as well. But I think what we're stuck with is that a lot of the people who are going to react to something like that are already not going to be too movable. Now, if I'm being too pessimistic, someone else jump in and say so.
Excuse me. No, I think it's important to be realistic, and we know that there are some places in the country that are very conservative, and it's very, very hard to get some of these messages out. And we've talked about before in other trainings about the spiral of silence, where if nobody talks about these things, or the, looking out for the greater good, or looking or saying that confidence and evoking that confidence in public health, then people don't think that that's real or that's possible. If somebody believes it but nobody else talks about it, then it's just within you. So the more we talk about this, we are continuing to repeat that, and we are continuing to enforce that in our audience's heads. And it may not win us the thing right away, but we are in this for the long term, and so we want to continue to put our messages out there. Kathy or Saniha, are there any questions that you want to uplift?
Yeah, there's so much good interaction going on. It's hard to keep up. But I think there's a lot that really get to doing this work in conservative areas, the ones that you already answered about dividing the audience, about mandates and government overreach. This one is sort of a continuation of that. Gaining trust. What has hurt the public health most in my eyes was when they seem to be caving into political pressure to open up the economy. How do you come back from that loss of trust in the information you're using? But we do have our director, we have a document where we're looking at all these questions, and Lori's point was we can start from where people are at. We can focus on the economy, and I put in the Q&A a BMSG report where we just looked at the news on a just recovery from COVID and really dove into how does the news cover the economy. And they often personify it, and they prioritize the economy or industries over people. So we need to talk about the workers in the industry. If we're talking about bailing out grocery stores or restaurants or the airline industry, that's not enough. We need to talk about the workers, and that will help us get more specific on the policy that actually benefits the workers that make the economy run rather than just the CEOs. And so we can use some of the lessons from that same report here to expand the frame around the economy to remind folks that it's made up of us, the people who work, purchase, and live in society. And without a healthy and thriving population, we can't have a thriving economy. Nothing happens in isolation. Queuing up the value of interconnection and talking about why public health is so important for all of us. And I think that, this also goes, we're talking a lot about messaging and framing, but there's a lot of organizational issues as well about gaining trust, about building up our communication infrastructure, so that we are putting out timely, accurate information that sort of goes beyond the framing. But I just want to acknowledge all three of these questions are big issues and are going to take time. There's not magic words. And it does go back to the strategy too, and using the layers of strategy to get really clear, on what is this specific thing we're trying to move right now, and how can that build to a longer term strategy to lift up what public health is, and getting really strategic about what we're doing, in this week, this month, what is this battle, and then how can we use that to set us up for long-term talking about public health.
Thanks, Kathy. I also want to answer this question I'm seeing here about is messaging framing different from CBOs versus government, so public health work that is done at the government level or versus at the local community-based organization level. And so we know a lot of this project was born out of the attacks that the authority of public health departments and public health authorities or officials have to enact mandates to set out the precautions that we need to contain the COVID-19. So we are talking about it in the sense of the governmental, because these attacks will have long-term repercussions on how public health is able to operate in the future. However, the framing that we talked about, the portrait versus the landscape and the personal responsibility versus the social share responsibility, that still applies whether you're working on a community-based organization or whether you are working on a government organization. What we want to evoke when talking about public health and what we do is that we are doing for the greater good, for everyone, and we're looking out for improving conditions so that everyone has healthy, happy, long lives, and that no matter where you're working, whether you're working on a government organization or a CBO.
Can I say one thing on that?
Yeah.
I always go back to the metaphor. I heard it from Makani Timba, who used to lead the Praxis Project, that, we want to think about our framing as there's a Christmas tree and we all want the same tree, right? We all want the same solution. We want to be very clear on that. We want to evoke some of the same values, but we may have different ornaments based on what we're bringing to the table. Working at a health department, you're probably always going to lead with the health case, no matter what issue you're working on. A CBO that is working on housing justice or economic justice might lead with that. But there's ways that we might be able to use our position and the layers of strategy. Again, I know we keep mentioning it, but it's very helpful to go back to it because it asks questions about who are your allies, and you can think about, are there things you can't say in government that maybe your allies could, and how do you build a more cohesive communication strategy against these attacks by working, across government, community organizations, grassroots folks, even getting, sometimes if it's hard to say something, there are retired public health officials who maybe could be more outspoken and don't have any restrictions on what they can say about legislation. So there's a lot of opportunities to build coalitions.
Here's another question about recommendations for potential targets to be public advocates, influencers, and public meetings, thinking about the rise of members of the public speaking out against vaccines, masking, public health in general at public meetings. Who is a good candidate to be the people speaking out publicly and in favor? I'll see if anybody else wants to say something about this, but I think this goes back to strategy and goes back to identifying who are your allies, who are your coalition partners, who are you working with, and how you're supporting some of those folks in providing training of speaking out publicly. It doesn't come natural to everyone. And so identifying someone who can do that. We often talk about authentic voices and bringing people who with lived experience to share their voices. And the only danger with that is that the story may stay with them as an individual. So we want people who are going to share their personal stories to be able to connect to the landscape and to talk about why we need public health and why we need a better system and an improvement so that nobody else has to have the same thing that happened to me. In identifying those public advocates, I think it's a lot of has a lot to do with the organizing part of the work that you're doing kind of behind the scenes. That is not just the vocal in the news piece, but I don't know if anyone else here has anything to say about that. No. All right, so I think we are almost at time. So I think we might be able to close this. I do want to say, again, thank you all for joining and sticking around. We will share all the materials, and we're also putting together a report where we're going to summarize all of these recommendations, and we're going to share that as soon as it becomes available. And Sarah, I don't know if you want to say anything else.
We don't have a private Facebook page to the chat to the person in the chat who recommended that, but the Act for Public Health Initiative is a collection of practitioners, folks in the kind of national public health law work in the field, all working together to try and collect resources, to put together events, to provide technical assistance. I dropped the link in the chat one more time, so feel free to sign up and stay connected with a group of us who, while we don't have a private Facebook page, are trying to stay privately connected kind of behind the scenes here. We'd love to hear from you. And thank you again, Berkeley Media Studies Group, Real Language. We just love partnering with you. This work is so important. And thank you to all the participants for so much great engagement. We're going to try and download the Q&A and the chat so that we can pull those resources together and provide that when we send out the follow-up resources. Thank you again.
Thank you so much.
To the hosts who are still on, I just wanted to ask if the Q&A can